All right. Hey, tribe, sorry for the delay. We were having some sound issues, but Chuck's here with us now, and we're going to talk to him about flight nursing. So, hi, Chuck.
Hey, good afternoon.
Hey there. So, what did you do prior that prepared you for flight nursing?
Sure. So before I went into the flight arena, I got out of the military and I worked in EMS prior to going to nursing school. I did both for about 2 years. I had gotten a bachelor's degree prior to getting my nursing degree, and
Sorry.
ended up getting my associate's degree in nursing, and then spent about 6 years or so doing emergency room work, in addition to working in ICUs, and in addition to a good solid 2 years on a med surge floor.
Okay, so I've had some brand new nurses or new students asking what they can do to adequately prepare themselves for flight nursing in the future. How long do you think they should be nurses for, and what do you think they should get their experience in prior to flight nursing?
Sure. So I think it depends on what program they're going to work for,
Mm-hmm.
and I think it depends on the crew configuration. So in the flight arena, you have fixed wing. Some places even do ground transport mixed with flight. And then obviously you have the rotor wing, the helicopter programs. So
Okay.
some programs work with a nurse and a paramedic. Other programs work with a nurse with the expectation being that they are also certified as a paramedic.
Mm-hmm.
And some of those programs work kind of nurse slash paramedic with a respiratory therapist. So it really depends upon your crew configuration. What I've found, I've worked a couple of different settings, is that the nurse with a paramedic is probably the best complement.
Yeah.
And if I'm going to go that route, what I would recommend is that they spend at least 2 to 3 years in a busy ICU setting. I think the ICU setting is more important than the emergency room setting. I think understanding invasive lines, pressors, balloon pumps, things like that. So if you can specialize in an ICU, I think that that's even better. I have a background in pediatric intensive care, which I think, a lot of folks don't have that. So I think that that was helpful for me coming into the field. But I also worked in EMS. So it's a little
Okay.
bit different approach. So if folks are looking at straight nursing, not looking to be a paramedic as well, I think they probably should do a year, maybe two, in an emergency room, and then probably another 2 or 3 in a busy ICU environment. So the path could be anywhere from 2 years to maybe 5 years.
Okay.
So there's a lot to know. There's a lot to learn.
For sure, for sure. Those of you that are viewing, thanks for tuning in. If you have questions, just type them below and I'll get to them as I see appropriate within our conversation. So someone asked, what are the hours like?
So again, that's typically dependent upon the location. So there are places where, very rural places, typically Canada, Alaska, and some other areas, where you may be on duty for a total of a week, maybe even 2 weeks straight without break. Crew rest is essential. I'll talk about that in just a moment. But I think when you're working around metropolitan areas, more the norm is kind of 3 12-hour shifts. In some programs, the program that I'm currently working with, we do 24-hour shifts. So it's actually a nice schedule. We do 24 on, we do 24 off, we do 24 on, and then we have a 5-day span where we're actually off. I don't think anybody just takes that 5 days off. I think
Yeah.
everybody's got a second job, or they're doing something on the side, schoolwork, that type of thing. But
Okay.
I think the majority of programs are probably leaning more towards 12 or 24-hour shifts. Our pilots only are allowed to work 12 with a max of 14 before they actually time out. But the medical crews can be stretched a little bit longer than that. So there is something essential to our operations, and that's crew rest. So if it comes down to, I've done too many flights and we
Mhm.
get a call, let's say in the middle of the night, and I'm too tired to take the call, or I don't feel that I'd be at my sharpest, we can turn that down for crew rest, and it would go to the next closest aircraft typically. So it's something that's taken very, very seriously in the industry.
You mentioned yesterday when we did our test call that you guys were down for weather.
Sure.
What is that? Do you have a ground crew that covers an emergency in those situations?
So there's different types of programs. There's programs that are affiliated with hospitals, and then there's programs that are freestanding. Our program is a freestanding community-based system, and we don't do ground transport, meaning that we don't have an ambulance that does it. However, if an ambulance were to show up at our base or request us, we can go with them via ground and perform all the same critical care skills that are outside of the scope of kind of the standard ground EMS folks. So like we have rapid sequence intubation and a couple of other I mean, we carry probably close to 100 medications in our bag. So there's a lot more to what we can do other than just kind of a fast transport. So when we're down for weather like that, we could go by ground, but we're not a dedicated ground service.
Okay. That's interesting. So if you're down for weather, then a dedicated ground service would then be doing the transport then?
Typically.
Yeah.
But again, like if there was something that happened nearby and they needed support, they needed a higher level of care. So you have ground providers that operate at the BLS level or basic life support. And then you have ALS, which is the advanced life support, which is typically a critical care tech or a paramedic. And then you have critical care transport, ground transport, which oftentimes includes a paramedic, a nurse, and the driver is usually an EMT. Most places kind of cap at the level of ALS and don't have critical care ground transport, and that's where we can actually assist if needed.
Great. So what is your training like? You have a new hire coming in, whether they have ICU experience or is that required? That might be required. What is your training like for preparing them for the flights? Sure.
So the training is really individual based. So there's always a baseline that we look at. So there's going to be a minimum amount of classroom time. And after we do, typically it's somewhere around 2 weeks of straight classroom. After we do that, we do a needs assessment testing to see where folks' strengths and weaknesses are. And then we put together a plan to focus on their weaknesses and bolster their strengths. And they will continue to do online training. We have so many hours of it that we do a year. I can tell you in the past year, I've probably done somewhere around 200 hours of Con Ed online. But in the initial orientation phase, the very first time that you step into the aircraft, you are not expected to perform autonomously. You're not expected to do any skills, actually. So you do the classroom, you do the orientation to your base and to your specific airframe. There's multiple different types of airframes. And then the first flight that you do is really kind of a safety around the aircraft. And then after that, depending on comfort level, you may start doing some individual skills or maybe just the assessment piece, learning the charting system, that type of thing. But it usually, I'm going to say with somebody who's very strong, probably talking somewhere between 12 and 20 flights before they work second seat, as we call it.
That's a lot. That's awesome.
It is a lot.
Yeah, that's great, though. I had a nurse that isn't able to attend today that entered a question that said, I know this requires a lot of autonomy. What prepared you to fulfill this role as a flight nurse? And do you ever have moments of doubting yourself or feeling helpless?
So I'd be dishonest if I said no. I can't really speak to specific events, but I had a mass casualty incident that happened about a month ago. It made national news, that type of thing. And I can tell you that wasn't overwhelmed at the time because you get very focused on what you need to do. But then in the days or weeks afterwards, you really have to take care of yourself. and kind of cleanse, because there's things that you just cannot be prepared for. When we get calls, and my background, like I said, was ICU, emergency room type of things. When we get calls, we have no idea, what we're walking into. Sometimes the scene's unsecure. Sometimes you could be walking into an emergency room where, things have gone sideways, due to the patient's illness or trauma process. You could be walking into something where the patient hasn't been extricated yet. So there are days, and I've been in this field for almost 30 years, and there are days where you are overwhelmed. The key is to focus on what we do with one individual patient, and fall back on your most basic training when things aren't working. So I can tell you, simple enough, ACLS or BLS, they say go back to the basics, A, B, C, D, E. And with our sickest patients, we probably never get off of that primary survey, or at least until we have them a little more stabilized. But if you follow a systematic approach, you end up doing pretty well.
Yeah. And you mentioned the stressful situation that you encountered not that long ago. I think that leads into this next question quite well. How do you decompress after a situation like that?
Right. So we are part of a debriefing with critical stress incident debriefs. We actually went to a debriefing for it. But I also see, and I think that this is, back when I was younger, I thought it was more of a sign of weakness, but I think it's a sign of strength, is that I have a therapist that I go and see, and I unload quarterly, sometimes every 6 months, just to kind of make sure that I'm in the right place. In the past, I buried myself in work, and that's not necessarily the best thing. So I think eating right, sleeping right, exercising when you can, having a great support system. My wife's an ER nurse, so she totally gets it. That type of thing, I think, is essential if you're going to work in this field. It's not really a great place for the loner, that doesn't have that support, because you can get in over your head pretty quickly.
Yeah, great advice. So someone says, I never met a tall flight nurse. I'm 6 foot tall, not a small person by any means. Are there restrictions?
So there's weight and balance restrictions more so than height restrictions, depending on the airframe. So there are some aircraft that sit very low to the ground, and there's other aircraft that are not a problem. If you were 6 foot tall, I don't know of. I used to work with a partner probably a decade ago that was 6'3", 6'4", and no problems around that airframe. With that being said, I can only speak to our program, but it's typically all about the weight of the crew more so than the height.
Okay, good. Is there a specific certification for your specialty? And if you've taken it, how did you prepare for that exam?
Sure. So there's a certified flight nurse exam. If you're going to work on the paramedicine side, there's a flight paramedic certified exam. The CFRN exam, the certified flight exam, is administered by the same folks that administer the CEN, or the certified emergency nurses exam. At one point in time, I held 5 board certifications, but at this point in time, there's so much continuing education, and I'm pursuing another degree in my downtime, that just maintaining the CFRN is kind of where I'm at. I teach those classes, so what I find is this, and I think that this would be good advice for folks that are looking to come into the field. We're always looking for people that have instructor status already behind them. Most of them have pretty good interactions with the public, so we look at PR skills. And the other thing that I find is that the more that I teach it, more that I have to find different strategies to teach certain folks, because not everybody learns the same way. So that makes me understand the material a lot more strongly. So I teach the CEN review, and I teach the CFRN review. And really, that's kind of how I prepared for it. So I used to take it every 4 years, but now I only have the one, the CFRN. So I will take it again next year when mine expires.
That's awesome.
And I will study. I'll study a lot. It's not an easy exam.
Yeah. And how do you recommend studying?
There's a lot of resources out there online.
Mm-hmm.
So FlightBridge is one of the programs. So if folks are looking, FlightBridge is a great company from what I've seen. I know Solim Enterprises, so they teach the CEN review, and I believe the CTRN, which is the certified trauma registered nurse, and the certified pediatric RN. Any of those review courses are fantastic, and all of your ABC courses like ACLS, TNCC, ENPC, those are all great to lay that foundation down for a systematic approach. And then in addition to that, I'll review. There's a bunch of resources out there from ASNA, ASTNA, which is our air surface transport organization. It's similar to like the ENA for emergency nurses. So I'll look at some of their materials as well.
Great. So do you have anyone giving, so this is a question entered by someone that isn't able to view today.
Sure.
They said, do you have anyone giving or setting your orders / parameters? Do you just decide them on your own?
No, we have patient care guidelines, as do most critical care transport services, ground, flight, otherwise. So we have specific guidelines for just about everything that you can think of, including medication administration, including procedural skills such as surgical crikes, chest tubes, that type of thing. We probably, I want to say we carry about 6, maybe 8 different types of pressors on the aircraft. So it really comes down to looking at the patient, looking at the pathophysiology, and determining which pressor you would use and why, staying within the framework of your guidelines. But as long as you're able to justify why through a pretty strong CQI process and be able to discuss it with your medical director if you need to prior to a transport, I think you're fine. So there is a lot of clinical decision-making that takes place around those guidelines. But again, if you have 8 pressors, it's important to know why your patient's hypotensive, not just I need to give a pressor.
Sure. Yeah, agreed. Okay, so let me see. We're kind of skipping around here in my list of questions. What makes good characteristics in your area?
Somebody who's confident, but willing to learn and willing to admit that they don't know the answer to something. That I think that's probably more important than anything. There's a lot of folks that come into this industry when I first did. I'm going to throw on my Superman cape and I'm going to save the world and that type of thing. And the trauma gods really don't like that very much. And they will humble you at every opportunity. So I think confidence is important, but I also think that person that is a continual learner, somebody that really finds themselves as a student to trauma, advanced medicine, that type of thing. I think that those folks probably do the best. I also think that humble personality is important as well. And there are times where I'm not humble. I'm not proud to say that. But I think when you're not, you get humbled pretty quickly in this field. You learn pretty quickly that there's a lot to learn and a lot to see. And like I said, I've been doing this for a very long time. And there are things that come up on a fairly routine basis that I have not seen before. So.
Okay. Amy asks, back to your previous answer regarding the orders. She said, is it similar to pre-formatted orders?
I want to, it's not quite that simple. So if I need something specifically, let's say blood, we don't carry blood in our program, but if I really feel that the patient needs blood, I would get an order from the sending physician who's responsible for that patient technically until they arrive at the receiving facility. I might not necessarily ask for it, but have that discussion with the physician and kind of together decide whether or not that would be the right course for the patient. So on something like that, it would be, we would follow our guidelines on how to administer, but together we would need something probably in writing as an order that the physician would like to administer, let's say 2 units of pack cells.
So this is probably a good time for you to go into giving us a visual picture of what does a typical transport look like, whether you want to give us a visual to responding on the scene of an accident or
Sure.
doing a transport from an outlying hospital, whatever it is.
Sure. So the way that we'll talk about 911 responses first. So we'll get a request for a field response. Let's just say a motor vehicle accident. That tends to be the most common call that we do. And the way that the call comes in is that an agency, being a police officer, a 911 dispatcher, being a first responder, they may call and request the helicopter right away. When that call comes into us, it comes in through a dispatch center, and then it comes to the pilot. The pilot's information is point A and point B. So basically they call us and they say that we have a trauma in this area, and the pilot looks at that area to kind of predict whether or not they can get in or not based on the weather.
Okay.
And then they also take a look at the closest receiving center, appropriate receiving center. So if it were a burn patient, we'd be looking at a burn center. For trauma, we're looking at a trauma center. Can they get from point A to point B and then back home? Being back home not as important. But that's all the information that they get initially. So there's no patient information. We don't want their decision-making skewed. And then there's something in the industry that says it takes 3 to go and 1 to say no. So we have specific weather parameters, and we don't violate those. That's the most important safety feature in this industry. So he makes the decision, we discuss it, we're all comfortable with it, we lift, and we're on our way. When we land, we are typically landing with fire departments that set up landing zones for us. And some programs do hot offload onloads, which means that the rotors stay turning, and other programs do cold, depending on the airframe. We approach the patient. We typically get report. It'll be in the back of the ambulance, or it might be on the side of the highway if they're not extricated yet. But everything is all about safety. So as much as we can do on the ground to stabilize, we do. But some of our sickest patients just need constant stabilization, which might be a load and go situation. So each patient's a little different, and it really depends on what's going on with the patient at the time that we arrive and make patient contact. For an interfacility, we just get from hospital A to hospital B, and we accept the mission or decline the mission based again on weather and time and that type of thing. Once we start the mission, we may turn around and abort for weather if something happens. You could have a mechanical issue. But if we do make patient contact, we continue with that patient to the receiving hospital. That would include if there were a problem with the aircraft and we had to go by ground.
Okay.
But it's all higher level of care. We have, like I said, RSI available to us. We have balloon pumps that we can manage in the field. We have ventilators that we manage in the field. Multiple different types of medications. So it's the way that I explain it on when we do a public relations event is that we are providing ICU level care in a broom closet at about 130 knots an hour with 2 people instead of a team of 10. Right.
Guys, if you have questions, those of you that are watching, get them in, because this will come to an end in probably 5 to 10 minutes here. So get them in if you have questions. All right. So what are the things you love the most about flight nursing and the things you dislike the most?
Dislike. I'll start with that. That's probably the easiest one to answer, because there's very little that I dislike about what I do. I love my job, and that makes it super, super easy. If you love what you're doing, it makes it easy to go to work every day. Love the teams that I work with. I work with a lot of super, super smart people. That includes ground providers. It includes some of the hospitals that we are frequently in, and it includes our pilots and our teammates. Our educators are second to none. Our program is second to none in terms of education. It's fantastic what they offer us. So I guess the only thing that I would say dislike is that I have to wear long sleeves, boots, and a helmet in the heat and in the cold. So super, super cold or super hot, those are probably the only times that I don't 100% love my job.
All right, good. I love that you love your job so much. The picture that you sent me when we decided to do this together, you agreed to do the Q&A, and you sent me a picture of your helmet.
Sure.
And those of you who are wondering, you can look back at the event and see the picture of Chuck's helmet. It says, "You're going to be all right." Is that right? It says?
Yeah.
Okay. Sorry, I'm doing that off of memory. But do you have like a specific story behind that, or?
When I used to do extraction, there were times where patients might not be able to hear you because of how loud it is. And it is super loud inside of the aircraft, so sometimes they can't hear us. If they've got head blocks in place, it makes it hard to put headphones on so that they can hear. And sometimes all they can do is look up. And I hope that someone may find comfort in their worst day if they had a horrible accident and they have to look up and see this mug. But across the helmet, they see you're going to be okay.
Oh, I love that. I thought it was a reminder for yourself. I'm so glad that I asked you.
Oh, no. So when I wear that helmet and looking down at the patient, they're able to look straight up and read it.
Yeah, that's awesome. I love that. All right. So one of the questions I ask, is there any desire to change your specialty? And it doesn't sound like there is, or try a different area of nursing. Anything that you would wish you could try or want to try? You're going back to school, so you must be headed to somewhere.
Yeah. So I am too old to go back to med school. If I were going to do anything differently, I might pursue a cardiology type degree in medicine.
Okay.
But at this point, I'm just looking at advancing my nursing degree.
Awesome.
CRNA, maybe. That's a fantastic job as well.
Yeah, for sure. All right. Is there anything else you want to tell us before we end our time together? It doesn't look like anyone that's watching has questions coming through. So.
Okay. I just want to say thank you for the time and the opportunity. And if anybody is interested in kind of the step-by-step approach to getting into the field, I'd be more than happy to field questions via Facebook. They can message me or on the site as well. I'd be happy to answer those.
That's great. I know there was tons of interest in flight nursing and a lot of people commenting saying that this is their dream job. So thanks for being open to question. I really appreciate your time. I know you had a busy afternoon planned.
Yeah, so just a second about that. We are doing a cadaver lab that's actually remote. So we brought the cadaver lab to us. And that's where I've been working with multiple teammates, our medical director and one of our medical education coordinators. So great opportunity.
That's amazing. So you guys are just doing an education piece for your staff there on site.
Absolutely.
That's awesome. I love it. Is that typical for flight teams to have that availability? That's pretty outstanding.
I think so. I worked for another program before I worked here, and we used to do different types of labs, including cadaver labs as well. So it is something that they offer during orientation, and this one is this is a fairly new program. But we're working with the Mary, the Mobile Education Research Institute, and we are very pleased.
That's awesome. I love to hear that. Thank you so much for your time, Chuck. I'm sorry about all the technical difficulties initially, but I'm glad we got this chance to talk to you.
All right. Thank you.
Have a great day.
You too.
Bye, Tribe.
For the opportunity.